Hello everyone, I'm Dr. Matt Pennell with Element Health and Wellness, and today I want to talk about low back pain, but specifically disc bulges and nerve root irritation. So I've drawn out three different pictures essentially of positions of the low back. So we're going to focus in at the lumbar spine. Here, picture number 2, or our center picture, is basically what normal should be. So when we're standing up, we have vertebrae, disc, vertebrae, and our lines just show the general curve of the low back based on the position. So from here, a lot of our patients that have the disc bulge, they may wake up in the morning with a lot of pain and irritation. They get it as they sit for a long period of time. And why do we get that? So when we're sitting for an extended period of time, we end up typically in a more flexed position like you see in the first picture. And what that does is it causes this disc to poke back, okay? And when it pokes posteriorly, it'll typically go to one side or cover both, but we'll focus on one. So let's say it goes back and to the left, and as I sit for a long period of time, I get the numbness tingling going down my left leg. All right, so that's because the disc is poking back and irritating that nerve root. And we can see pain. It can be paresthesia or tingling sensation that'll go all the way to the foot. It can just go to the knee or to the hip. So then, when the person stands up and moves, they don't get as much pain, and that's because our disc is more evened out and taking the pressure off the nerve. So the end result, what do we want to do? We want to work on soft tissue to ease up some of the muscle tension. We want to do some adjustments to allow for better mobility of the spine. And then we have picture number 3, which is the extension. And we will show exercises in the office that are referred to as McKenzie Extension. Okay, and what they're typically are press ups to allow this disc to go back forward and take pressure off the nerve. So now I'm going to show you just a brief way to go through the McKenzie Extension. So I like, you can do the floor or couch, bed, but just try to make sure that the surface is a little bit firm so it doesn't cave in on you as you go through the exercise. But we'll sit down. We'll go to our side and then go on our stomach, and from here we have our elbows underneath our chest. Everything's nice and relaxed, so it's 3 steps. Step 1, we're going to take a big breath in, go up on the elbows, breathe out. Step 2, let your stomach sink down towards the table, and then number 3 is you rest down completely and really let everything relax. So we're going to show it all together. Big breath, breathe out, hold, and then rest. Where people go wrong is that they'll take the big breath and get up top, but as they breathe out, they just collapse down without holding. So I want to make sure, big breath, breathe out, and then rest. And you can see my stomach sinks down as we do that. Then when you have low back pain, we want to make sure that you turn to one side, okay? Put our elbow in hand. We want to swing the feet out front, and then you're going to sit yourself up to a nice position. Make sure that your feet are underneath you, and then you stand up from there. There's your tip for the day. Hope you guys enjoyed. If you have questions, please let us know on low back pain and disc bulge nerve root irritation.